Welcome to the reALLERGIES podcast, a show exploring FPIES through real conversations with patients, parents, and clinicians. This episode is brought to you by the International FPIES Association, the leading global advocacy organization for food protein-induced enterocolitis syndrome. This podcast is for informational purposes only and is not medical advice. Always consult your healthcare provider. The views shared are those of the host and guest. The reALLERGIES podcast is proudly sponsored by Genentech, a leading biotechnology company dedicated to advancing science and improving patients' lives, doing now what patients need next. And now, here's your host, Fallon Schultz.
We're back. It's been a while. Welcome to the reALLERGIES podcast, which is our FPIES podcast from the patient, parent, and clinician perspective. We had a very, very busy February and March at the American Academy of Allergy and Asthma, American Academy of Allergy, Asthma, and Immunology meeting. And so we're finally regrouping. We're finally getting back on our feet. And we're excited to launch this new episode of the podcast and share a topic that is a lot of the times the dreaded topic of FPIES. Today, I'm joined by Landon and Anya, and we have a special guest, Dr. Sara Anvari from Texas Children's Hospital. And she is a pediatric allergist who specializes in oral food challenges and recently published a very interesting paper on some new protocols and new ways to approach oral food challenges to ensure that patients and families have options in this process. So welcome, everyone. Thank you for joining. Thank you for being here. Let's dive right into it. So let's talk about what is an oral food challenge. Who would like to jump in on that?
I can definitely jump in on that. All right. Well, thanks so much, Fallon, for the great welcome. And I will start off by, defining that oral food challenges are where you are giving the food that the patient is allergic to in a protocol approach where you might be giving it as a single dose. In the case of FPIES, you might be giving it as a single dose or maybe 2 or 3 divided doses. And you might, even depending on whether the patient might have a positive skin test to their FPIES food trigger, you might even do a few more steps instead of just like 1 or 2 steps. But it's practically giving that food so that you are able to determine whether the individual is still allergic or has resolution or is now tolerant to that food trigger and they've outgrown it. And
Sure.
The observation period occurs right afterwards, so that we can make sure a reaction, if it were to happen, we can take control of it and bring the patient back to their normal baseline again if there were to
Which
react.
we're going to really dive into later on in terms of what that is like. And so thank you, Sara, because it's a medical procedure, essentially. And it's not anyone's favorite. I think that I can speak as a mother of a child that's probably done, I don't know, Landon, how many oral food challenges would you say that you've done over the years? Like 60?
Too many to count.
At least. The feeling and the fear never goes away. It's manageable and different, but every single time you're walking in there with that anxiety and fear. And so I wanted to kind of open up with some of that and get a perspective from someone who is the individual who has to put themselves in this situation, knowing that they have had significant vomiting and an allergic reaction to the food. And Landon, I wanted you to share a little bit, if you wouldn't mind, a little bit about what your experience around oral food challenges has been like from when you were younger to as you got a little bit older to where you are now.
Yeah, of course. So, obviously, when I was younger, I had a lot more triggers than I do now because I've grown out of most of them. But I think the worst part about it is that you're having your food, right? And you're 2 hours after you're eating your food, you're like, oh my God, I feel okay. I'm gonna be completely fine. And then the next minute, it could just turn for the worst like that. And then you're like, all upset. Like that was my big thing. Like I was so happy when I tried peanut butter or something for the first time, and then my whole life changed for 3 months. It was not fun, but as I got older, the protocols have changed a little bit to where I've became more confident during challenges, like the whole micro dosing stuff that I've been doing recently. It really gives me more confidence in it, and it makes me feel better towards knowing that or thinking that it'll be a better outcome. So stuff like that, basically.
Thanks, Landon. And it it you have to. I know I've watched you over the years have to put yourself in a mindset that sometimes as a parent I've always worried about. Right? You worry about what what is going on in my child psychologically, where I'm putting him in a situation where I'm telling him it's safe, I trust his medical providers, but I'm signing a consent for something that could make him really sick. And that's an area that I don't think many people talk about. And I think in the medical community, in the family community especially, parents are afraid to speak up about that. So like I really want to give that a voice, is the fear of speaking up about the fear of the the oral food challenge because of the reaction, but also the fear of, I did this to my child. The guilt and the shame that's involved when they do fail, and the responsibility that you feel, because it's really one of the only options that we have. So Anya and Sarah, as clinicians, when you have families that come to you, how do you know when they're anxious, and what are some of the things that you do or that you advise them or guide them through to help them through that anxiety, and also to protect them a little bit from that fear that they are doing something that they worry could have a negative outcome, and that they're authorizing to do a procedure like that?
I think I would add, so those are great issues and like very important issues. And I think we have to admit that the reason why we do those challenges is because we don't have anything better. It's our gold standard for diagnosis, and not only for FPIES, but also for IG-mediated food allergy. With all of the research that we've done for IG-mediated food allergy, we still end up, feeding the child or an adult to find out, how allergic they are. So it's inevitable in a way. We are still on the quest to find a perfect biomarker that would replace that food challenge. And the really difficult task in FPIES is that we cannot follow IgE, we cannot follow the skin prick test to at least kind of narrow down, like have that. This is like going in blindly, right? Like, we just take the leap of faith and we agree that the risk is worth, the potential benefit. Um, and what you're asking is really important because it's a leap of faith, right? And the parent and the child have to be ready for it. So I would never ever say you have to do a challenge. It's always a, how do you feel about it? Do you want to do it? Is it going to help you? Is it going to help your child? And kind of understand what is the light at the end of the tunnel, right? Like if it works, what do you gain from it, right? Like what's the ultimate advantage of doing this, even though you know that there are risks associated with it. It can be unpleasant, it's a long day, it's a lot of fear, anxiety, and hope, and then like you are crushed because, as Landon said, in a minute everything changes. So I don't know about you, Sarah, but I big academic centers like ours, right? Usually we have access to resources like behavioral psychologists, and we can work with the families and just asking simply, how do you feel about it? What do you worry about? And also kind of judging if the child is ready to try a new food, because a lot of our patients are such picky eaters that if you offer them something that they've avoided all their life, and it has a foreign kind of strange texture and smell and look, then expecting them to eat that food it's a tall order. So I think that's a negotiation. I would say that this is like really
Mm,
like a very delicate balance, because sometimes we really want to do it, because if you're avoiding a big food, right, like milk or egg or wheat or even oat, right, for that matter, which is such a common food, and Sarah can speak to it. What are the reasons, why is it important to do challenges? Because not a one size fit all. There would
yeah,
be situations that certain foods may be more important and worth it for a given family or a patient to do, where for others would be like, it's not an issue. I would never sign up for that for my child. So
right.
it's incredibly individualized process. But I think I found through the years that we as physicians are very poor judges of like emotions or feelings that the families have. And sometimes just asking very simple question, how do you feel about it? What do you worry about? Then the person who seems to be totally in charge and in control and collected, then they fall apart, right? If you ask a very simple question. So I
Yeah.
think we have to ask. We just have to ask, because then we can come out with the resources and connecting patients, even waiting, right? Like waiting, let's wait for a better moment to do it.
Mhm.
And take time to do some intervention therapy, counseling, connecting them with the patients who went through that procedure, right? And kind of
Mhm.
can share the experience. That's what I'm thinking. I don't know what Sarah's
I
take on it.
I 100%, 110% echo everything you've just said, Anya, because it's really that readiness and being able to understand, are they ready or not ready yet? And how important is that food in their diet? Because a really great example of a case that I had last week where I had a patient who hasn't been able to introduce anything into their child's diet. And they, had one food trigger, and it was, a particular fruit. And the mom was really just like, I really don't care about introducing that food into my child's diet. I just want to introduce something,
I
but
love
I
that you're
just
bringing this up.
yeah, and I,
I
I, I
love
was like, I
it.
just, I
Yeah.
felt like that moment, I was like, okay, yes, this mom is desperate to get something into her child's diet other than just a formula that the child has been surviving and thriving on. But at the
Hmm.
same time, I realized I'm here to like provide a procedure that can determine whether this individual is outgrown their food trigger and what's the point. And the point of it is that mom was trying to tell me that I don't even think he'll eat that food trigger if you even try to introduce it, because he's not even been able to eat anything in
Hmm.
his whole like entire life except for those first few months before everything really started to crumble down and he couldn't tolerate anything. And so that's where I really took that step and said that okay, it's important that we really address the big elephant in the room, and it's that there's probably a huge food aversion issue because of all these years of him not being able to eat anything and just purely just being fed formula. We may not even be able to successfully get that food into his system because he's not experienced what that texture is like. And so I think, again, to what Anya said, it's really incredibly important to assess that readiness and to see, well, is this even
Yeah.
what they're ready to do? And are they, how do they feel about it? And kind of help allay those fears, like to Anya's point again, that don't just rush into a food challenge until you know that the family has collected all the resources and actually felt good about, okay, I understand it. I've talked to some other parents and I've been to the resources that you've referred me to. And I think my child's ready now. I'm ready now as a parent. And so that kind of really sets the stage for hopefully success. Fingers crossed that a challenge is a success at the end when the observation period ends.
What I would add here that, again, if you have your doctor is in a big center, you can have access to feeding therapy, or psychologists, but so many of our patients don't. They don't even have an allergist who is knowledgeable in FPIES, or they don't have even access to the food challenges. So that's why I just want to point out that the Lonnie's Lounge is such an amazing resource, because I was just thinking, like, for your patients, Sarah, Fallon can teach them how to make popsicles, and ice cream from that formula, and how to introduce different textures so the kid can practice, trying something that looks
Oh yeah.
different and kind of feels
Yeah.
different in the mouth. But I'm sure, Landon, do you remember those times when mom was doing this to prep you for the food challenge? Because like, having avoided so many different foods, it must have been a huge challenge, right? How did you,
Yeah,
Fallon? Yeah,
definitely.
how did mom prepare you for those challenges?
Well, every challenge was different, and she'd obviously tell me the risk beforehand. Like,
Mm,
listen, this is a serious like food that you've tested, but we have to do it. We have to expand your diet, and no matter the outcome, I always trusted her. There's like I'm never not gonna trust her, even if I get sick. Like, that's just how my body is. It has nothing to do with her. But I always went in when I was younger. I always went in scared because my biggest fear when I was younger was throwing up and having to stay in the hospital.
mm,
Because anytime I got sick, we'd be there for a week because no one knew what was going on. But as time went on, I was like, okay, like, I'm getting older. It's not as bad. I could deal with it now. But as I started passing more and more foods, it like built up the confidence, and like,
mm.
obviously I'm a kid. I hate being away from home. The 2 hour drive stinks, but um it's something I had to do no matter what, to especially for college, because I'm going to be going out. I need
Mm-hmm.
stuff in my diet that I'll be able to eat. She's been taking me out to restaurants, showing me what to do, stuff like that. But she always pours confidence into me, and I'm pretty sure that's plays a major role in where I am today.
Jeez, Landon, we're supposed to be professional today. You're gonna make me like bawl my eyes out. Um, yeah, it's hard,
But
right? And I think that there needs to be some autonomy in the decision making from the patient and the child in terms of what food they want to eat or what food they want to try. And Sarah, you hit the nail on the head, right? A lot of the times, and Landon, I'm sure you can chime in on this, like, our experience was, you're doing this food, this food, this food, and it would be like, but these foods don't mean anything to us in our diet. We don't care about that. We want this. He wants pizza. He wants that. Can we build towards that? And I think as we're working on changing protocols in oral food challenges, Anya, you had shared, like, there's a difference between functional foods and ancillary foods or supplemental foods like an avocado versus an egg or milk or oat. And I think what's challenging is a lot of the common triggers are those functional foods. And so I know, like, as Landon's mom, and these are things I had to learn completely on my own because there's no one to teach you. And I think that it's important to note, and I'm going to say this from the parent community, you can make as many referrals to psychologists and feeding specialists, but if they don't know FPIES specifically, it becomes another dead end for those families. And we don't have enough mental health clinicians or feeding specialists that are trained. And so sometimes that referral, which is well intended, could misland, and it can kind of sometimes make it even more difficult. It's like it's another avenue of support that I'm reaching out to. And that's why that specialized kind of hand holding and support is so needed, which is why we created Lonnie's Lounge, right? Like that's the whole reason of this telecoaching platform is we know it, we understand it, we can walk you through it, we can get you prepared for challenges. We can even be there with you while you're having a challenge and talking to you through this, right? Like during the actual challenge. But I think that there needs to be more autonomy in the decision making in terms of what foods are challenges, especially if you have a kid like Landon that had multiple food FPIES, where thankfully most children and adults only have one or two triggers. So that's a different scenario of reintroduction. But there also needs to be a piece of, and this is my favorite thing when I meet families on Lonnie's Lounge and they're getting ready to challenge foods, whether it's the structure of the medical oral food challenge or an at-home challenge, they're so worked up by low risk, high risk. I've read this on the internet. I know this is out there. And they're so confused because it's first foods of introduction that their children are reacting to. And one thing that brings them back home is I say, what do you and your family like to eat? What do you eat for breakfast? What do you eat for lunch? And what do you eat for dinner? Okay, let's start there, because guess what? If we can introduce foods that you all eat together, you're not going to feel the heaviness. And Landon, I think you can speak to this, right? Like when you would pass a new food, we would make it a thing. Like it would be a thing in our house, and we would eat that food in every variety that you could possibly eat it in and integrate it into the diet. And that's another thing. It's like, well, what does it mean to eat it regularly? Regularly means how often do you eat steak? How often do you eat chicken? How often do you eat, broccoli? That's what eating regularly means, meaning no hesitation, no reservation. You're just incorporating it into the diet. And I think that those are the pieces that kind of get missed when we have discussions about oral food challenges or we choose foods. If we choose foods based on, obviously, if there's nutritional deficiencies and multiple foods that they're avoiding, that's one piece. Like Landon. Like for Landon, it was for survival. It was, we need these foods. You're not gaining, you're not growing. That's one scenario. But in other scenarios, it's what do you and your family like to eat? And guess what? Here's the beautiful thing about food. There's so many different foods. So, for example, if you eat eggs for breakfast every single morning, and you eat muffins with your family, and your child has FPIES to eggs, the first thing we should be doing is identifying what the substitutes are for egg that can be utilized so that you can get the function of egg in food, like applesauce or flaxseed or baking soda, things that can replace the function of the egg. And when we do that, like Landon, you can speak to this, right? We were always finding substitutions so that when you couldn't eat a food because of safety or FPIES, we found something so that you can at least eat with your friends. And maybe it was you bringing the food, right? But at least, I don't want to say at least because I don't want to minimize your experience, but there came a point in your journey where you got to decide what foods you wanted to trial, right? Can you talk about that? Can you share what that point felt like for you?
Yeah. So, later on in my life, after we got all the majority of the ones that I needed to survive, like you said, I started picking out like, oh, what are all my friends eating? Oh, what looks the best when we go out? Oh, what smells the best? Like when we tried pork and beef, those were stuff that like at home we eat steak all the time now. Um,
How is your cholesterol?
Bacon.
Watch.
Fine, keep eating the steak. It's fine.
There are drugs
He's
for
eating
that.
filet mignon. Let's be honest. He's not eating like.
Yeah. Um, I mean, bacon, obviously. I had the turkey bacon. Wasn't the greatest. We don't have to talk about that, but uh, once actual bacon got introduced, it was a game changer. I always have it with my dad. Bread was the big one.
Yeah, remember when
Like
you had bread for
two,
he hated bread because he had to have
yeah,
these like gluten-free, like cardboardy breads. And when he passed wheat, this is a great story, right? When he passed wheat, first he didn't want to do the challenge because he had failed 3 oral food challenges, even in the hospital, to wheat previously. So it was a lot of failing. And he was like, I'm not doing it. I don't want bread. I don't like pasta. I don't want anything. And we're Italian. We eat pasta like all the time. So when he ate the bread for the first time, it was, he was like, he couldn't even believe it. And then I was like, I'm making you a sandwich for the first time. And he's like, I hate bread. I don't want to eat it. And do you remember when you had the sandwich for the first time?
yeah, it was game changing.
Oh.
Now he eats like 20 sandwiches. I can't
Oh
even
my
keep up,
goodness.
right? All right.
Did you
Two a day,
do
almost every
you
day at lunch.
do you have a bread machine that you can bake it at home? Because the smell of a fresh bread is something.
I don't. I'll have to ask Dad
That's
about that.
next.
Well, yeah.
That's
So
next.
his father is like this phenomenal baker. I keep telling him, I'm like, you would kill it in food allergy. So he makes all these
Yeah.
amazing food allergy bread, like focaccia and things like that.
Uh-huh.
We make sure he eats really well. Anya, you were going to chime in before. I'm sorry if I interrupted you.
No, you didn't. But I just wanted to say that that Landon has said something really, so important and like resonated with my experience is that he always trusted you. And it's such a big role. Like, he always felt that you were in charge, that you wouldn't lie to him, that he was safe with you. And kids pick up on their parents,
Yeah.
how the parent is feeling. If the parent is anxious and apprehensive and it's like super worried, uh, this is going to be a difficult experience for
Mm-hmm.
everybody, because children, even if it's unspoken, right, like
Yeah.
they sense it. So it's so
Yeah.
important to get the parent to the place where they are ready and they want to do it and they feel like, this is the right decision to
Mhm.
do. And what you said about, even well-intentioned referrals sometimes might backfire.
Yeah.
So, we have to be aware of that.
I think I want to, so if I'm fully being honest, right, and that's what reALLERGIES is about.
Mhm.
We all knew you were worried for wheat.
I'm sure
I,
you were, but you
yeah,
kept
Yep.
it together, right? Like
yeah.
you're the
There's a,
cheerleader.
yeah, there's a almost like a culture that comes with this as a parent. You're an over functioner and you're hyper vigilant. And it comes with FPIES, especially when you have a child that has multiple food FPIES. And I think a lot of people see or have seen, especially in my life, like, and I love that Landon felt the confidence from me because I knew I had to parent his childhood in what his reality was. And there were lots of times where I was not confident and not okay, but I needed to show my son the confidence and give him the tools. And I've never sugarcoated things for Landon. And I don't mean in the way of talking like, oh, these are the horror stories, but I always presented to him, these are the potential outcomes. And I think that's important, especially when your child starts getting a little bit older, explaining it to them, having the discussions of what this means. I mean, Landon would probably say, like, I have drilled this into his head a million times, like, make sure that you have your ondansetron, make sure, like all of these different pieces. But if I'm being like very, very honest and truthful, I was very rattled inside for like years. And it did take its toll on me. It took its toll on me physically. It took its toll on me mentally. It was really hard. I would say that I had like PTSD, post traumatic stress from it. I really did. For me, I'm a Capricorn, as you two ladies are too. As we know, what do we do when we have these situations? We channel it into something. And so for me, if starting this organization is almost a if you want a real snapshot into what was going on inside of me, I had to find answers to make it work because there were no answers, and I really couldn't handle what I was feeling inside. And so I poured it into finding answers and creating avenues and finding the best doctors in the world because I was scared. I was scared. And I had to learn a way to be present for my son to ensure that not only was he safe, but mentally and emotionally he was healthy. And there were times that inside I was not. And I think that it's important to honor that in FPIES parents because when I had these conversations on Lonnie's Lounge with parents and one of the questions, like Anya, you had said, how do you feel about it? One of the questions I ask is, has this been traumatizing for you? You as the parents? And I don't think we do enough to check in on mom and dad and to see how they're handling this. That is the predictor, I think, of the outcome of how well the child does, is how well mom, it's usually mom, I'm not trying to discredit dads, but it's usually mom, that maternal instinct and those feelings. If mom is not doing okay, the child is going to have a much harder time. Would And Landon, Landon, you have seen me have very hard times, like you've sprayed. It's not been hidden, but we've talked about it, right? Do you want to chime in on that?
Yeah, especially the whole gastroparesis process
Oh,
was really hard for both of us. Like you coming into the nurse's office, tearing up, watching me just sip chicken broth for lunch for 3 months. I could only imagine what happened when you got home, but I know that played a big toll on you. Definitely.
Yeah. And it's there's a beauty that comes with living with FPIES. There is a resilience and a trust, right? There's a trust. Like he'll make you laugh. Like I can smell body chemistry changes on him. Like right, I'll be like, Landon, I can smell you're getting sick, and he'll be like, what? And people will probably think that's nuts, but then like it usually happens, right? Like I'm so attuned to him. And I think that that's a blessing in one area and a curse in another, right? Because the blessing is like we're so attuned to each other and we've learned to trust each other, but it's also from being in this super hyper vigilant, over functioning mindset. And I think the reason I bring this up is because I don't want parents out there to feel like you have to push yourself through and be something that you can't physically or mentally be. I want parents to know like you can break down, you can, and you do have valid feelings in this. And then I also want families to know you can get through this. And a lot of amazing things will come out of this, like a beautiful relationship of trust, and you will get through this. It's manageable. You will get to the other side. And I think that, having a podcast like this where we're talking about all of our different perspectives on this is so important, right? Because it's got to be hard for you as clinicians as well to watch your families breaking down. And I know I've had conversations with both of you when you've had a lot of these patients that are really struggling. That's hard for you too. It's got to be really hard for you, and you want to do what's best for the patients and the families, but I'm sure you go home at night thinking about some of these patients.
Yeah, I think one of the biggest things that you've really pointed out is just that confidence that the parent really has and displays when they come in for these food challenges. And we're just seeing the surface. We're not seeing,
Well,
what's,
disassociation.
yeah. And I 100% really, really do understand what that now means, because I I am always incredibly amazed at all of the parents that come in for these food challenges and just how stoic they are. And whether it's the FPIES challenge or it's the IgE challenge, I've watched them just be like this strong rock right there. And even when the reaction's happening, I, would imagine okay, there's going to be this,
Please.
yeah, like something will just, kind of start to show, and the anxiety and fear will definitely, you know, come to surface. But there's still this outer toughness, they're doing everything they possibly can for their child, and doing whatever to show that strength, that I am doing this for my kid, and I'm doing this because I chose to. My child may not be old enough to have that voice, and really trying to keep it together while my kid can get back to baseline as my doctors are, putting the medication through and getting everything back to normal again.
Yeah.
I am always incredibly amazed at the families when I see the food challenges happen before, during, and after. And I'm even pause for a minute and think to myself, like, how do you feel, Sarah? It's like,
Right.
well, I feel like my blood sugar is just dropped, it's plummeted.
And
And
your blood pressure is really high.
yeah, I was like, I've just activated every system in my body, and it's in an emergency state, but I am keeping it calm and collected on the outside. So God only knows how they feel. Like if I'm sensing this internally just to keep things cool, control, and making sure that patient is as safe as possible and bringing them back to their state of health,
Keeping the right
in
temperature in the room, right? Everybody's trying to
yeah,
keep the right temperature in the room for the child.
yeah.
Yeah.
So that tells me, like, if I feel this way, I can just only imagine how the parent is feeling on the other side. And that, it just amazes me. Like, I've done this over several times, and feeling this way has really gotten to a point where I'm just kind of like cool, calm, collected, because I need to be in control and give instructions to everybody in the room and say, okay, let's do this, let's do this. But to see a parent who you're like, but they're not in the same kind of environment as I am every day, and they don't do this every day, but they do it differently. And they
Yeah.
have a different set of fears and anxieties, and they've just learned to keep it cool and collected for that moment, and for many moments, even outside of that office.
Well, we still have Landon. I want to transition into, okay, so we're talking about the heavy part of the emotion, but now let's really talk about the win, right? The success of it.
Can
Because, yeah,
can I just say something here?
Yeah.
Because then I forget, but you and Landon said two very important things. Like, even before we get into the technicalities, you said, you ask, what do you eat? What does your family eat? Because the success of the challenge is not only passing the challenge on the day off, but incorporating the food into the diet. So, and many of our patients are those picky eaters. They have very complex relationship with the food, and I think that having them participate in the meal with the family is
Yes,
so important to that
extremely.
long-term success. So that's one point that I want to make, and like the shared decision point, but also part. But Landon, you said that you at some point, like, you wanted to go out with your friends and you were looking what they're eating and you wanted to eat what they were eating, and it's always like it's over and over again the same thing. Like, I don't know, Sarah, if you have the same thing. Kids get like 12, 13, and then when they start going out without their parents, and now all of a sudden they are interested in trying the food. And whether before they were like, well, I don't want it. I don't need it. So there are times, right? Like, there are different motivations,
Yeah.
and the attitudes can change. But once they change and we do the procedure, then we
I
do
think
that.
it's exposure too, right? Like
Yeah.
when they're little, they're not eating for the reasons that they're eating as teenagers or young adults. And um like there were a lot of times like Landon, you would miss a lot of school to do these challenges, right? And then when you would pass a food and you'd come back, like even your friends would be excited for you. Like we've had friends that would get if it was a pass, I'd go out and buy the food and put it in their house and make sure that they kept their fridge stocked or their cabinet stocked so that he could feel the win, right? So Lynn, how would you describe if there were other FPIES patients, not just kids, because adults go through this too, how would you describe what it feels like when you have had to avoid a food and maybe you have failed it a couple of times and then you finally pass it?
Well, we talked about it before, but obviously wheat was the really big one. Um, After trying something that you failed over and over and over again, there's always like the thought in your mind, like, it's gonna happen again. Like, maybe I'll never grow out of this. But once you actually grow out of it and you do pass that food, I mean, it's one of the best feelings I've ever like experienced because I nobody else, none of my friends have that feeling either. Like they haven't went through all of this. They haven't missed 40 days a year of school, doing food challenges, being stuck in the hospital for 25 days. It's it really feels special and like egg, something like that. Something that I tried when I was little and I didn't pass. And then I tried again and now I eat them every day. It's like, where would I be without it right now, you know? It it really like switches your mindset on a bunch of stuff and it makes you feel like it's possible.
What would you tell another patient, another parent, and another physician? What would you want them to know about oral food challenges, failing and passing?
For a patient, a fail always might not be the worst thing because you could always come back to it and with wheat, again, the more I tried it and failed, I feel like your body might build up a tolerance to it or something like that. So if you keep trying it, I feel like that would play a factor in it. Like, okay, maybe after your body's been exposed to it multiple times, it'll sink in and it'll be okay for you. A pass, everyone's got to love a pass. It's a great feeling. For a parent, I know it's for you, it's always hard to see me go through a fail, see me in that like state, but you know it won't last forever. And it's a short period of time, or it could be a long period of time for recovery, but you know you'll end up being okay. For a pass, go go spoil your kid with the food for the day.
Yeah.
Like it's awesome. When I passed potato, you made everything possible with a potato.
We did a potato
I
buffet.
couldn't stop eating it. Couldn't stop.
Wow.
And I guess for a clinician, a bunch of doctors that tested on me when I was younger, they're always scared of me because of how bad I would react. Recently, I had one for wheat, and he was like kind of scared. He came in a little nervous, like, uh-oh, what's gonna happen? If I was a doctor, I'd be a little scared too, seeing my sheet and my chart. But um, I think even if it's a fail, you want to keep the patient like their head up. Like it might happen once, but if you come back again, think on like the bright side, and it could always happen. You could pass again.
Yeah, that's so helpful, Landon. And I remember when we were at Quad AI this year, Landon is pretty famous at Chop, I would say.
Oh.
And we had gotten invited to attend a gala, and we ran into one of Landon's docs, who was one of the doctors who used to do his food challenges when he was younger. Do you want to share what he had said?
He he couldn't believe that where I was right now because I had what 30, 40 foods I
32.
was 32 foods I was allergic to, and he was like, that's crazy how many you've outgrown. He remembers I was only able to eat 5 foods, and now where I'm at, my diet's completely expanded, and even he thought like, how did that happen? How's that possible? But it was pretty awesome to show someone that it could turn around and you could be
Yeah, he was
different.
joking with us that he used to try to call out on the days that he would have to do a Landon Schultz oral food challenge because he didn't want to do
Oh.
it.
Yeah, he was
And he
getting
was just so
nervous.
happy for Landon. He was like, this is amazing. And so I bring that, I love everything you just said. And thank you, because there's so much hope in this, and it does get better with time. It doesn't mean that while you're in it, it's easy. It doesn't mean that everything is going to be great. You're going to have dark days. You're going to have very hard, dark days, and that's okay. I think that's the message we need to give patients and parents and clinicians. It's okay. And I love what you said, Landon, like keep trying, because when it lands, it's the best feeling ever. And it's the best. I know for me, when Landon would pass a food, I mean, I would almost have like these like little breakdowns. Like I would cry. I would get this release of like, oh my gosh, there's one more off. Like, let's make this fun. Like I would go nuts, like with the potato bar and all of these different things. And that feeling that you get in those little mini relief as your child, as your patient starts to outgrow, that feeling becomes consistent. It's the regular, it's the temperature, right? We change the temperature in the room. And it's important to lean on support, and it's really important to have a good relationship with your medical team. I know that Landon's medical team has been essentially like family to us over the years, and we trust them. We trust them, and that's important. You have to trust your medical provider as well. And so it's so important to have conversations around the realities of it and to educate and to be open. And I liked, Anya, how you said negotiate. It's a collaborative effort. And even if you're not ready right now, that's okay. You'll get to a place at some point where you are, and it's usually when they outgrow it. And that's what's even cooler. Like that's when it goes away. So Landon, I want to thank you for joining us today and for really adding some great insights into oral food challenges and what a success story you are. And I love you and I'm so proud of you. And you're who I want to be when I grow up. You're the most inspiring person I've ever met in my life. And I know that your story is going to help so many. So thank you for sharing it.
Of course.
Thanks, Landon.
So,
Thanks,
so
Landon.
we're going to end this episode, and we have a second episode that we will be diving into on the more medical technicalities of the oral food challenge with Sara and Anya. So Landon, thank you for joining us, and stay tuned for our next episode.